Welcome back to our discussion on relative energy deficiency in sport. In this final section, we'll focus on prevention, how athletes, coaches, and clinicians can support proper fueling, reduce risk, and create healthier sport environments. So, Dr. Casey, how does low energy availability specifically impair performance?
I think a good analogy for this, since so many of us have our smartphones, is thinking about, when your phone is on low power mode and, it says, hey, click low power, we're going to, and it sort of starts to conserve the power of the phone. And you see the lights a little dimmer, maybe it works a little bit more slowly, sluggishly, or some apps might not even work at all. And that is kind of the idea of how REDS can contribute to impaired performance. So it could lead to, I think I mentioned before, reduced coordination, reduced learning of new physical tasks, reduced motivation and sort of energy and getting, as much as you'd like out of your training, notwithstanding injury, of course, which can interrupt that as well. And thinking about if you're operating in your low power mode all the time, the phone and you just won't perform as well as you'd like, and not getting as much out of the training that you're working so hard to do. So that's kind of all of the systems and processes are just operating at a reduced level because the energy isn't there to operate fully functionally.
And Heidi, how do you, if you were busy, as you mentioned, people are busy. How do busy athletes and active women balance proper, their performance and training with making sure they're getting adequate fueling?
Yeah, I think it's very much a strategic planning sort of approach where you really have to look at your day, look at your at night, look at your day the next day. Where are my eating opportunities? Where am I going to get my food from? What do I have to bring with me to be sure I have it when I need it? Because it doesn't just happen. Like, you can't play defense when it comes to food, right? Like, you really have to be proactive. And I think it's hard because it's under this umbrella of self-care, and depending upon age and accessibility and responsibility, it's hard in teenage years. Teenagers are in a here and now place. They're not very good at thinking ahead, and so then they get hungry in what's available. And I think, and that doesn't necessarily change as we get older. We'd love somebody to still take care of us and have that food provided, But so it's really it becomes just a very functional thing, and then. Obviously, really, I guess we'll talk a little bit more about this, rejecting diet culture, because it's great to think that doesn't infiltrate athletes, but it is actually the opposite. Athletes are at a higher risk because of the attention on their bodies. So they're at a higher risk for eating disorders and for just disordered eating and feeling that scrutiny, which impacts their food.
And you mentioned everyone should be screened for this. So what are the sort of screening strategies that people could be aware of to pick up on this?
Right. So if you are, a female athlete and anticipate, that you biologically will have a menstrual cycle, then screening for how old are you when it started? And if you're 15 and you haven't gotten your period yet, that's a screening question. Also, if you started your period, let's say you started at 13, and then you take up a new sport and you're training and you're loving it, and all of a sudden notice, this seems like it's a little longer, between the times when I'm getting my period, or you stop getting it altogether. So female athletes actually have an advantage in this case because there is a menstrual cycle to track. As we mentioned, in male athletes, it's harder to know that this might be going on because that isn't an obvious sign that you can actually, check off on a calendar and an app and see what that, duration of time is between the cycle. So for sure, that's a great way. But asking about, when I see people asking about recurrent injury, but if you're a coach and you have, an athlete who is always seeming to get injured, especially those sort of gradual onset, not trauma, that nobody crashed into them, but they've always got something, that would be an indication to chat with maybe the athlete or the family, depending on their age. This might be something that we should get investigated. A change in somebody's a sort of interest in the sport or attention, concentration, energy. Those would all be potential reasons. There's so many other things that could be going on, but it certainly can't hurt to explore something. Whereas if it's as simple as, in some cases, having a snack, before your training, that can make a huge difference, that's doable. And it's not always that simple, but a lot of times, a small intervention can have a big impact. So looking for it and then asking questions and saying, hey, maybe you should go, get this looked at is a great start.
Great. And Heidi, do you have any tips for effective ways to you mentioned diet culture, and do you have ways that you can foster a team or a sport culture that supports fueling and recovery?
Well, I think to start with, there's so many, right? There's so many, but really focusing on function. What is it our bodies can do? Again, like what is the task at hand? Do you need power? Do you need strength? Do you need endurance? What are the techniques and skills for this sport that you can work on? Those are the things that are going to take us closer to performing better. Mental preparedness, adequate sleep. And as a coach, you don't have to be prescriptive, but just saying, hey, I hope you all had a good breakfast, or I hope you all had a snack before you showed up at practice today. Or, we have competition tomorrow. I hope you get a great pregame meal in. Sends a message of what you value. We've heard horror stories, of coaches saying like, don't eat too much over Thanksgiving, or I can't, coming back, it looks like you gained some weight over Christmas break, or, where the focus, of course, how do people going to react? And it is true that what a coach says has the greatest influence on an athlete, regardless of the team around. So, the coach's responsibility is great in setting a tone. And there are coaches that have actually banned fat talk or body talk in their in the locker room, having frank conversations about period health and expectation of, of making sure that their athletes fuel adequately. That says a lot. So I think, and then obviously no group weigh-ins, there are 40 different parameters that have been shown to be essential in terms of developing an athlete, like what makes an athlete. And weight is just one. So it is not the determining factor for any athlete, even for athletes in aesthetic sports. And also body image has very little to do with what we actually look like. By the way, that's a other thing. So I think that there are lots of ways in which to promote a very fuel up environment.
And can you both kind of talk a little bit about how social media and our current culture affect REDs?
Certainly, athletes are, as Heidi mentioned, so susceptible to, not only how they feel about their body image, but if they're on social media and putting themselves out there, which many do, to get recruited. You're in college and there's, name, image, likeness, and people, can have wonderful opportunities related to putting themselves out there. But it does allow that sort of anonymous, these people to comment, and sadly they do, on what they look like or what this might mean for, their competitive success. And it would be very difficult for anyone, especially somebody who's in that high profile position and maybe during, periods of growth and maturation, to, take all that in and have to process it and navigate that. And social media, I think in general, is about, kind of putting up unrealistic, expectations about anything, body image certainly, but also how clean your house is, how clean you're eating, you name it. And the culture has these, kind of unrealistic sort of people on a pedestal, but it's not real. Of course, that's the sad part, but it's hard to distance yourself from that if you're also in a very form-fitting outfit and having, 20,000 people in the stands and online observing what you're doing. So it makes them even more susceptible to, I think, struggling with body image. And when that's part of your brand, because athletes can become a brand, then it's really challenging to separate that from how you feel about yourself.
Yeah, I mean, I was just thinking about this whole uniform thing, and what year was it where a volleyball team was finally able to wear? I think Pink paid for the. They were fined because they wore
Yeah.
bikini bottoms. They wore shorts instead of bikini bottoms,
Right.
and then
Yeah.
Pink stepped in and said, "I'll pay your fine," and then they finally got it where they could wear shorts. I mean, that's a whole different issue that we're not going to singularly be here to
Right.
change, but it is all an influencing factor, and I just love that there are more and more influencers and athletes who are clapping back, and celebrities who are clapping back at those who dare to criticize their bodies, who are not the ones in the ring, are not the ones in doing that competition that make comments on their body when they don't have the strength, the power, like all of that. So it is, I think social media can be really damning and difficult to navigate. And then there's, from a nutrition standpoint, a study came out that highlighted how only 2% of the information on TikTok, nutrition information on TikTok, is accurate. And how many of our athletes and general population look to social media for their nutrition information? And we talked like what's the low carb thing, or drinking raw milk, which can be really harmful actually. All of these trends. So I think also helping athletes. Look, we're not coming up with the social media literacy is a thing, but it's a real thing for a real reason, because if that is where you're going to find your information, then finding out, how do you find sports nutrition programs that put information out? How do you look to universities and hospitals for their information, or sports RDs that are putting out? Look for those social media accounts, curate your feed instead of somebody who thinks because what they did is what is right for everybody else. And by the way, to your point, half the time it's not true. Like, we've seen social media where an example is a woman would be sitting there going, I have 8 glasses of water a day. I haven't had alcohol in, 2 months, and I never have sugar. And then behind the scene, is like a glass of wine with a donut or something, right? But that's not on. It's just that's just not. And most of the time, it's just not true. And to remember, I can eat and exercise exactly as you eat and exercise, and we're not going to look the same or have the same results on the field, because there's so much more involved.
Yeah. And finally, Dr. Casey, what emerging research are you most excited about? And are there certain knowledge gaps that you are hoping will be filled soon?
Yeah, so I think ones that have been filled, which are promising, are, again, thinking about this well outside sort of that typical athlete that we used to think, in the early 90s was at risk. We're thinking about more broadly. We're thinking about men. We're thinking about all sorts of, abled bodies and abilities can be at risk for this. So that's a big advancement. The dream would be to have a very simple, accurate, low cost, low effort way to determine energy availability, which, I don't know that will ever be the case, but there's got to be some evolutions in technology and ways to partner, data collecting that then a sports dietitian could utilize to get a more accurate assessment, because it's not just a one fixed number in time. It can change, as you said, from day to day. It can change across a season, or even, a kind of a part of the lifespan. So knowing what that is more accurately would be incredible in terms of advancing research. And then I think ways to educate, and whether that's through social media or how to get the information out there so that athletes, families, coaches, medical community is more aware, because early intervention, I think, is, makes a huge impact.
Yeah, I mean, I'm all about prevention, right? Like I and I think Women's Sports Medicine Center, again, tries to go out into the community and give some talks. I do a lot with performing arts. It's interesting when I work with interns who then learn through my work as I'm teaching them about REDS. They'll go, oh my gosh, I wish I knew this, because invariably most of my interns have been athletes. And they'll go, I wish I knew this in high school. And I said, well, if you did, would you have listened? And interestingly, many of them say no.
Yeah.
Yeah. So it's really catching, our body image, our attitude around food, it starts pretty young. And once you're in it, yes, there is total hope for getting, you can certainly get over REDS. You can eat your way up and out of reds. But it's a process, and it takes its toll. And so, yeah, I think education and prevention can go really far. And I've seen that as I have athletes come up to me, and young women, come up to me and go like this, especially when I've worked one-on-one and we talk about blocking the noise, and we talk, and they'll go into a situation and they come back and they go like, yeah, I hear this, I see this, and now I'm not part of it. And that really is great. I feel so much more empowered to navigate my way through all of sort of these landmines of social media and the diet culture that is sitting around that training table.
Well, thank you both for sharing your knowledge with us today, and thank you for tuning in.